We found the Mental Health Champions course one of the most useful things we've ever done.
You know, we would often come away, my colleague and I, and sort of say, gosh, it just makes you want to go back to school and you know, tell that child that, you know, they're really important to us and we're not going to let them down.
I learned a huge amount about attachment theory and adverse childhood experiences. As an educator, you need to know about these things.
It allowed us to take that wider learning that we're receiving on the course right down to explicit factors within our own school and to talk about our children, our context, and to get advice and guidance.
The environment was incredibly supportive, it was confidential, it allowed that opportunity for really free discussion.
One of the things that I didn't expect to dig so deeply into was the fact that as educators we are all a crucial resource, and looking after that resource, being mindful of our own emotional well-being was very, very important.
It was very important to have enough time between the training sessions. Had they all been week after week after week, we wouldn't be able to go in and work on the things that we had learnt that week and build them into our school's action plan and on our subject-specific action plans.
The self-assessment tool enabled us to reflect on what we already had in place as a school, but it also allowed us to see what we needed to do and the areas we weren't addressing. In particular, that was for us joined up thinking between teams within the school.
We weren't sharing our learning about promoting good mental health with our parent community. So one of our key pieces of learning from the course is that's what we were going to do.
With the support of the staff from Place to Be, we quite quickly realised that we needed to take smaller steps and to get all of our stakeholders engaged in what we wanted to achieve and plan more of a long-term project.
I feel that the children have a better understanding of who in school is available to help them, what they can do in order to self-regulate, and to know that we still like them.
Children right from year 1 all the way through to year 6 have personal wellbeing lessons now.
We've been able to help children develop their self-esteem, particularly self-awareness and resilience.
So the point of the wellbeing curriculum would enable teachers to be able to feel empowered to deal with an issue themselves rather than putting in a referral for a learning mentor.
We're not only raising the profile of looking after ourselves, but actually putting in place some practical ways of making sure that we are all looking after each other.
We also had the parents in and did a special presentation to them to introduce that kind of vocabulary to them, and also actually we gave them some exercises to do during the training session to show them how they might use some of that vocabulary at home when they had problems with children at home.
I think I would say to anyone new embarking on this programme is to approach it with an open mind. Don't feel constrained by perhaps the things that your school already has in place.
You're going to embed this within your school, but you are told that you have the support around you, and that's what our course did beautifully, and James was very, very good at making sure that we understood where we could go for advice.
You will learn so much about yourself, about your school, and you will have the power to make a difference in your school.
Championing children's mental health and emotional well-being is, from now on, is going to be central to what we do, rather than an add-on or, some additional thing. It's right at the heart of what everyone does.